One of the main ways we differentiate ourselves from most other international charities is that we focus on the locals. We recognize the fact that anything that's going to have a long-term impact has to revolve around the locals. You make sure we have them on our side. And quite frankly, it pays dividends because they understand a lot of the issues that we may not understand. They understand the politics, they understand the importation, they understand how the medical community works. So instead of us going and maybe stepping on toes, they're there to kind of help us make the right decisions. And we found, unfortunately, through past experience, that many times with us coming in and trying to do all the work for them, in reality we're hurting them. We're hurting their personal business. In many of these parts of the world, it's the brain drain that is the biggest thing that they need to overcome. They could be training great doctors in their local universities, but if they don't have anywhere to go and practice and make a living, then they're eventually going to immigrate or come into the United States, go to Europe, work as a nurse, and kind of squander all their training. So we have found that maybe one of the biggest benefits we can provide to any given country is to assist those doctors to move to these underserved communities and have a practice where they can actually make a living and stay permanently. We can help them to attract the local paying patients, which may be few, but it can sustain a practice, it can sustain a nice quality of life, and the rest of their time they will devote to helping the poor. So it's a win-win. The doctor now can stay in their country. The local community that was previously underserved has a doctor, and those that couldn't afford a doctor now have somebody that's willing to accept them into their practice and to see them. So that's why we think it's important, and why our model is so centered on the local practitioner. Many times we might feel like we need to go and solve the problem for them, and we just don't see it from the eyes of the locals that in doing that we could be hurting them. Matter of fact, I met with the Minister of Health in Haiti. We were talking about, it was the earthquake had just happened, and we were having a meeting with a number of NGOs talking about how we could help them to rebuild. And I remember the Minister of Health said, she mentioned to us that the biggest problem that she was dealing with was how to manage these foreign groups that were coming in. Everybody wanted to come in and provide help, and they were doing it probably for the right reason, but they just don't realize that there's also an infrastructure there already in place that is trying to support themselves and maintain their standard of living, their ability to practice. And so that needed to be taken care of. She needed to, her main focus was, how can I keep the locals in business and keep the foreigners out of our business? We can use the foreigners' help in specific areas, but for the most part what they do is they drive out the people that we do have there here permanently. An example of that would be, I was in Haiti previous to the earthquake, and I was meeting with people at the Albert Schweitzer Hospital, which is in the middle of the country, and they were overwhelmed with the patient base and the geographic area they were trying to cover. And they were showing me on a map, and they said, this whole part of the country here, see, there's no doctors here. There's nothing there at all. And so now we've kind of picked that up, and we're trying to help those people out. And I asked them, I said, well, why aren't there any doctors in that area? And they said, well, a few years ago we had a foreign group that came in with good intentions. They built a hospital, and they had just a rotation of foreign doctors that came and just did work for free. And what a wonderful thing. Well, funding changed, direction of the charity changed, and after a couple years, they closed that operation down, and they pulled out. Well, unfortunately, prior to them pulling out, every other local doctor had left, because how can a local doctor compete with a free? And so none of them could make a living, none of them could be there, and no doctor now was in that part of the country. And there's no doctor there today. And so now we have a whole part of this country that is underserved, has nobody to help them with their needs, all because a foreign group had a great idea. And that great idea really was detrimental to the local economy.